Hi everybody, welcome to our YouTube channel SRIP Edu Pharma. Now we are going to start with our new topic, Basics of Intrauterine Drug Delivery. This topic we will be discussing in two parts. In first part, we will be discussing what is the concept of intrauterine drug delivery, then why this is better as compared to other forms of contraceptives, then what are the advantages, disadvantages of this delivery, and what are the important risk factors associated with it, and just examples of types of intrauterine devices. And in second part, we will be discussing in detail the types of intrauterine devices, their mechanism, their benefits, as well as their contraindications or side effects. So before discussing about intrauterine drug delivery, we will initially discuss what is contraception and what are the various methods of contraception. So basically, the deliberate use of artificial methods to prevent pregnancy as a consequence of sexual intercourse is known as contraception. And the contraceptives are the ways to reduce the need for abortion by preventing unwanted pregnancies. Now there could be various type of reasons for this, like when the girl is below age, or any couple they doesn't want the baby, or there can be various others social reasons also because of which they don't want the pregnancy to be sustained. So for that reason, to prevent pregnancy, the contraceptives are used. There are various types of methods for contraception, like oral contraceptive pills, example combo mini pill. Then there are barrier methods like condom, diaphragm, cervical, cap and sponge. Then there are intrauterine devices, which are of three types. First generation, second generation, and third generation. Like example is progesterone, then copper T, then next is foam, then rhythm, then subdermal implant, example Norplant. These are some of the methods of contraception. But the ideal method of contraception should be the one that has a minimum number of births with the lowest number of method related deaths. So as you have seen, there are various type of methods of contraceptives, but here we are comparing intrauterine devices with the contraceptive pills because these two methods are mostly used. Now oral contraceptive pills, they are systemic contraceptive activity. Like here the hormones are taken orally and they act as contraceptives. But in IUDs, there is local contraceptive activity, and from local the drug is systemically absorbed. Then in the case of pills, there is lower rate of birth, but as compared to pills in IUDs, there is higher rate of birth. And the probability of death is higher in contraceptive pills than IUDs. Similarly, in IUDs, there is lower probability of death. And in our oral contraceptive pills, there is greater risk, but in IUDs, there is less risk. And in oral contraceptives, because continuously in a fixed pattern, the person has to take the pills, so it is less patient compliant. But in the case of IUDs, once we have inserted it, then there is no need for bothering about it. So the patient compliance is more in this case. So this is just a brief comparison between these two methods. Now we will discuss about intrauterine devices. As the name suggests, intra means inside, uterine devices means the devices which are to be inserted in the uterus. So intrauterine devices are also called as intrauterine contraceptive devices, and they are very small devices which are inserted into the uterus to interrupt the process of insemination. Here we are saying insemination. In this, what happens? The sperms of the male comes to the uterus of the female, where it comes in contact with the ova, and thereby the zygote is formed, that is fertilization occurs, and by that the childbirth occurs later on. So this is the basic concept, and in that if we try to either kill the sperm or we could not allow to form the zygote, then it could be the way of contraception. Now in this it is called as a temporary method because this is inserted for a particular time duration, and when the person wants to stop then they can remove, and later on they can again it is means it does not affect the fertility. So further if they want again they can go for the childbirth. So it is very popular method as it is long term, then it is reversible contraception and it can be easily fitted and removed. Just we have to take care that if there is sexually transmitted infection in any women, then in that case these methods are not suitable or not of choice. Now we will see the types of intrauterine devices. They are of three types: first generation, second generation and third generation. First generation is called as non-hormonal, inert and non-medicated because in this no medicament or no drug is involved. Only there is a device. For example, Lippes loop, SAF coil, you can see here. The detail of mechanism related to it we will be discussing in second video. Then second generation IUDs, they are non-hormonal but they are medicated because in this copper ions are involved. So second generation is also called as copper intrauterine devices. In this example is Paragard, then copper 7, copper T. Then there are more advanced ones like multi-load copper. Then it is also known as MLCU 250, MLCU 375. Here 250, 375 is the area that is involved, area of this device, that is the number 250 or 375 that we'll see later in the detail of types. Then comes third generation. In third generation all the things are same, but here it is hormonal or medicated because in this there is a hormone cylinder from which the hormone releases gradually. So which hormones are involved? Progesterone or levonorgestrel, these are involved. So what are the trade name or brands related to this type? Progestisert, Mirena, Liletta and Skyla. These are some of the brand names of third generation of intrauterine device. Now we will see what are the important advantages. So they are simple to use, so simplicity, then effectiveness, longevity means for long term it can be used, then it can be used almost for any woman including nulliparous. Nulliparous means the woman who has not given birth to any child. For them also it could be used. Then its action lasts for 10 years if it is not removed in between. The onset of action is immediate, like immediately when we use it, after that the contraception is achieved. Then it is independent of sexual activity, it doesn't interfere with intercourse. Then it can be used while breastfeeding or for lactating women. Then the quickly reversible as the fertility returns promptly on discontinuation. Then it can be used by women who are on any type of medication also. It is not associated with cancer of any organ. Unlike hormonal contraception, it does not cause weight gain, it does not usually affect mood or sex drive, and it is very economical. There are some special advantages also, like it is suitable for women who cannot use estrogen containing contraceptives, like those who have history of venous thromboembolism, those with stroke, myocardial infarction or any other forms of arterial disease or heart diseases, then those with long-standing diabetes, those subjects to migraines or women over 35 years who smoke heavily. In these are the special cases, so in those cases also intrauterine devices are used. If there are advantages, then there are limitations also. So in limitations, the important one is menorrhagia. What is menorrhagia? It means prolonged bleeding occurs. It is a frequent complaint that is observed when the patient is using intrauterine devices. Then there is dysmenorrhea. Dysmenorrhea means painful menstrual periods are observed. Then there is polymenorrhea, means shorter menstrual cycle could be seen. We know that menstrual cycle is of 28 days. So if it again comes in 20 days or 15 days, then that is called shorter menstrual cycle. So these are the major reasons for discontinuation of intrauterine devices. Then as we have already seen that they don't offer any protection against sexually transmitted infections. Then there is slight risk of acquiring uterine infection also while the intrauterine devices are inserted. This is seen generally within 20 days of the procedure. And it also has been seen that during insertion it could be a bit painful. And Paragard, we know that it is a copper type, and in Paragard sometimes the menstrual cramps are observed which are very worse. So these are some of the side effects which are usually seen in first 6 months of use only. After that they go away. There are some risks also related to intrauterine devices, like they are not recommended for women who might be pregnant, those who have untreated cervical or any type of uterine cancer, those who have unexplained vaginal bleeding, those who have multiple sexual partners, because there is risk of sexually transmitted infections. Then copper intrauterine devices are not recommended for people who are or who might be allergic to copper, or women who have Wilson's disease. Then in rare conditions it has been seen that the intrauterine device can penetrate the uterine wall. If the pregnancy does occur with an IUD in place, then there is increased risk to pregnancy also. Then hormonal intrauterine devices are not recommended for women who have severe liver disease or who have or may have breast cancer. Then there is a slight risk of infection when the doctor inserts the intrauterine device. They may test for sexually transmitted infection first. There could be some contraindications or side effects also, like irregular vaginal bleeding which has not been diagnosed and could be due to the cancer of the female sexual organs. Then there might be current or recent past history of pelvic infection, inflammation, or sexually transmitted disease. Then in current dysmenorrhea or menorrhagia, which could be worsened by the use of intrauterine devices. Then in the case of small uterus or pelvic abnormal uterine anatomy, it is avoided, or it should be not used. Then in the case of ovarian, cervical or endometrial cancer, it has to be not used. Then comes malignant trophoblastic disease. Then in the case of structural heart diseases with history of bacterial endocarditis, then in pervious ectopic pregnancy or in suspected pregnancy. These are some of the situations in which intrauterine devices are contraindicated. So this was the first video related to intrauterine devices. In second video, we will be discussing in detail the types of intrauterine devices, what is the mechanism of their use, as well as how it is inserted in the uterus. So thank you so much. Keep watching our videos and do like, share and subscribe the channel SRIP Edu Pharma and press the bell icon for new video notifications.